Experts and policymakers have called on African governments to invest more in research and development as a long-term strategy to bridging the health financing gap in the continent. Over years, much of Africa's health research has depended on donor support, often shaped by external priorities. This emerged during a roundtable meeting of journalists and African research champions from Kenya under African Voices of Science, an initiative by Speak Up Africa to strategically reposition African voices in science for improved health systems for all. At the Nairobi meeting, the champions, Dr. Robert Karanja, a biomedical scientist, Dr. Lisa Micheni, a senior lecturer in medical microbiology at Pwani University, and Mr. John Paul Omolo, a public health professional and health policy strategist, maintained that stronger domestic investment in research and innovation will enable African countries to develop homegrown health solutions to benefit Africans.
In terms of need, Africa is actually 25% of the global disease burden. Is it true that we don't have money? I think some of those things are changing. One of the biggest policy changes has been Trump. Trump has simply said from today onwards it's going to be America first. And if you believe that your people are not worth saving with your own money, well, shock on you.
The government need to be supportive when it comes to research. I appreciate they have done their bit, but more need to be done. The government has concentrated so much on the PPPs when it comes to infrastructure, but then to the roads, to the railways, to the airport, but then the research arms that we would require, they would also pump some money there, and then the private investors also can come in, and we will be able to have these research facilities that we would be utilizing here in Africa without having to send our samples out there for analysis.
The trio mentioned that for decades, Africa has largely been consuming products from research done outside the continent, thus compromising some products' efficacy as compared to the population where the research was done.
Africa was not accustomed to doing research. And a lot of the time, when research is not done in the continent, we say, here in that was the thing for the Europe. But when it's also brought closer, we have a challenge. People say, why are you using us as guinea pigs? When we fall sick, we say, hatuna madawa, na hii dawa haifanyi, like we don't have this medicine, and these medicines will not work on us. We need to start communicating, one, why research needs to be done in the continent, not only to the policymakers, but to communities. What are the benefits of doing research? We must talk to communities to accept research and development, or other research that is being done, and also accept new products that have been generated within the continent.
Dr. Karanja further revealed that over the past decade, there has been a significant shift in how research and development is conducted. He said drugs and vaccines development is increasingly being guided by advances in DNA and genomic research. However, African genetic data accounts for less than 3% of the global biobank, highlighting a major gap in representation.
So we also see not just a supply chain because of market failure, we are now starting to encounter another failure of the R&D pipeline, where the inputs for R&D are also lacking. Second thing is, you move from discovery, you go to translational research, which is now clinical trials. Out of all the clinical trials happening globally, it's only 4% that's actually happening in Africa. So they are designing drugs and vaccines without our DNA input. They are doing clinical validation of these drugs and vaccines, even diagnostics, without testing it on us. So for us, whether these drugs will ever work for the African peoples is a hit or miss. And that to me is what is really scary.
In addition, Mr. Omolo observed that there has been a number of research done over years, but only end up at pilot stage, even after proving their effectiveness in enhancing livelihoods. This is because of a combination of financial, policy, institutional, and market challenges. The Abuja Declaration, adopted during the second ordinary session of the African Union Assembly held in Abuja, Nigeria in 2006, saw African member states commit to allocating 1% of their country's GDP to research and development as a starting point.
So 1% is our starting point. There are several countries that have put more. The best countries in Africa currently put about 0.8 of their GDP to research and development. And take note, this is 0.8 of GDP. Kenya is one of them. Kenya puts about 0.8. South Africa is putting 0.8. But remember, our GDPs are different. It is true that within the African context, we work within very tight physical space and so many competing priorities. Are we doing enough? No, because Kenya even went ahead and said you need to put 2% of our research and development total R&D, be it in agriculture, health, to research and development. But of the 2%, 30% to go to health research and development. Are we there? Not at all. But we are progressively getting there.
As Africa moves towards self-reliance, the researchers challenged health advocates and the media to constantly keep tracking countries' budget-making process to see how much allocations go to research and development and be able to communicate to decision and policymakers on the need to start looking at research as an economic reliever for countries rather than a consuming sector.
Think about research and development as an economic lever for economies, for countries, and not as a consuming sector. We need to tell that story differently.
The experts admitted that a lot of research do not get to be translated into policies because most scientists are still conservative and avoid speaking to policymakers, patient groups, media, and the civil society.
We are trying to change the narrative where we are able to speak the language, the scientific language, in a way that even policymakers are able to translate into policy and policy implementation.
With the formation of African Medicine Agency, AMA, which works to align medicine regulations across African countries, researchers will be able to conduct multi-country clinical trials more easily and reduce duplication of regulatory approvals. The African Union, through African Union Development Agencies, came up with 2 continental policy framework strategies created to strengthen research, innovation, and development in Africa. The duo strategies, that is, the Health Research and Innovation Strategy for Africa, HIRISA 2018 to 2030, and Science, Technology and Innovation Strategy for Africa, STISA 2034, forms Africa's continental roadmap for strengthening research and development and ensuring African solutions to African challenges. This aligns with Agenda 2063 on the Africa we want. Reporting for Mesha, I am Christine Ochogo.